Hello, everyone. Just do a quick comms check. Um, if you can throw a thumbs up as a reaction, let me know you can hear me. Awesome. Thank you for that. I'll give it just a couple more minutes. Just the participation numbers keep climbing. So just give it a couple minutes for people to jump in. And if you are here for a resource showcase of NACHO and ASTO tools regarding radiation and chemical preparedness, you are in the right spot. All right, so I'll go ahead and get started and people will trickle in as they do. We do have a jam-packed agenda today, so I want to make sure that I'm respectful of your guys' time. So welcome to our webinar, Enhancing Public Health Preparedness for Chemical and Radiation Emergencies. This is, again, a resource showcase from NACHO and ASTO. My name is Jerry Joseph, Director of Preparedness at NACHO, the National Association of County and City Health Officials. And my co-presenter today is Annie Evans, Director of Preparedness at ASTO, the Association of State and Territorial Health Officials. You'll hear from Annie a little later on in this presentation. Also joining us are our CDC partners, starting with Captain Jill Schugert, Allison Stargell, Commander James Gooch, and Lauren Finklia. You will hear from them throughout the presentation. They'll be providing brief remarks throughout and perhaps engaging with some of you all in the chat as they has questions along the way. A few rules of engagement for this webinar. We do have a designated time for Q&A towards the end. However, chat participation is encouraged. We'll be monitoring the chat along the way. Just know we may not substantially answer a lot of the questions until that designated time, but we will definitely capture those questions. And also notice that we are recording this session and it will be shared with you all after. So watch out for newsletters and our blog posts for that. And lastly, I want to encourage the use of our reaction emoji. So if there's something that strikes you and you want to give it a thumbs up, a heart, what have you, feel free to do so. We highly encourage the engagement. Just a quick look at the agenda. I won't go over it too detailed, just to point out that we do have that Q&A at the end and we'll present opportunities to engage with us further. But just kind of leave that there for a sec so you can see. And with that, I will pass it on to Captain Jill Schugert to get us started with opening remarks.
Great. Thank you so much, Jerry. Good afternoon or good morning, wherever you are joining us from. As mentioned, my name is Captain Jill Schugert, and I am the Associate Director for the Coordinating Office of Environmental Readiness, Response, and Recovery at the Centers for Disease Control and Prevention, or CDC's National Center for Environmental Health, NCEH, and the Agency for Toxic Substances and Disease Registry, or ATSDR. Thank you so much for being with us here today. I want to thank NACHO for bringing us all together for this important topic and for including ASTO to discuss the important role of NAR. And I'm also excited to be joined by my NCEH ATSDR colleagues today. CDC's National Center for Environmental Health houses the Radiation Studies section that provides resources, data, and information to protect the nation from radiation emergencies. ATSDR's mission is to protect communities from harmful health effects related to exposures to hazardous substances. Together, NCEH ATSDR supports state, tribal, local, and territorial public health organizations to better prepare for, respond to, and recover from chemical and radiation emergencies. But we can't do it alone. We know that all responses are local and that chemical and radiation emergencies can be complex. We rely on our partnerships with public health organizations to make sure that we receive critical feedback from state and locals about what's important, where the gaps are, and how we can best support you. This ensures our resources are used efficiently and our shared impacts have the broadest reach. I'm really proud of the work our partners are going to share with you today. I hope you find it helpful and that we can continue working together to keep our communities healthy and safe. Thanks again for joining us today and for all you do, and I'll turn it back to you, Jerry.
Thank you, Jill, for that. All right, so let's jump into it. So chemical incidences may not happen every day, but when they do, they can have lasting and significant impacts on our communities. Local health departments play a critical role in minimizing harm, coordinating with partners, and guiding recovery efforts. The challenge is that these incidents are high impact and low probability, which means it takes extra effort. Readiness is going to take extra effort. That's where NACCHO comes in. We've created a package of tools to help health departments prepare more effectively, tools that are practical, accessible, and ready to be integrated into your existing plans or to help you develop new plans. So at a glance, this is the suite of resources NACCHO has created over the past 2 years, really, to help health departments, and I'm excited to share these resources with you. The toolkit includes a planning handbook, ready-to-use tabletop exercise package that includes situation manuals, facilitation slide decks, EEGs, after-action reports. We've developed template press releases that cover situational awareness, evacuation, shelter in place, repatriation, recovery, and post-incident response, and companion social media bites to go along with these press releases. We've also created FAQs for FEP planners and coordinators. Lastly, we've also developed ChemPrep Connect, which is our virtual community to foster learning and sharing of ideas and resources. And I'll go into each one of these one by one. The first of which is our Chemical Preparedness Handbook, which was where it all started. It's really the foundation of all the materials that we've created for your use as you guys plan in your jurisdictions. This handbook was developed and written by your peers. We put together a focus group and then a core group of writers to help us put this together and kind of figure out what are the bits of information that local health department planners need in order to put together a chemical preparedness plan. So in this, we have created practical checklists, guidance and strategies. It's kind of written in a chapter format almost. We have preparedness, response, recovery, and mitigation as the main headers, and then planning considerations that fall under each of those sections. It includes real-world examples and case studies from local health departments, and we kind of see it as a roadmap for developing or updating your emergency operations plan. Within this document, we stress heavily on the importance of understanding your jurisdictional and legal authorities as health departments, reviewing your existing hazard risk assessments and any existing plans that may be complementary or helpful in developing a chemical specific plan. We outline federal response resources that are available to you all so you know to ask for them. We highlight organizations that LHD should consider partnering with, like your local emergency planning committee. We explain what that even is, and poison control centers within your states. We also, again, have those case studies of past chemical emergencies and then links to external information. I want to stress that this document is not a plan within itself. However, it is a document to help you, again, review or create your plans, to help you think through questions that you should be asking when you are developing your plan, and kind of think of the partnerships that you need to foster when you are putting these plans together. And again, available on our website. To help sustain learning and share ideas, we've created this virtual community of practice focused on chemical preparedness. This online community gives local health departments and their partners a space to connect, exchange resources, and discuss monthly topics. It's a place where you can ask questions, troubleshoot challenges, and learn from your peers who may have faced similar issues. So at this point, this community of practice, we're so proud of it. It is now 94 members strong. If you are interested in joining, you can find that on our NACHO website under virtual communities. And again, you can see this is a screen clip of some of the ongoing conversations that have happened. On this, we discuss challenges and exchange resources. We participate in monthly topic discussions and peer-to-peer learning. So usually what we'll do is do a blog post with a topical topic, and invite folks to engage in those conversations or contribute to those conversations. And it's been going very strong. And in the future, we love to continue to build this out, add our resources on there for folks to be able to have a place to, again, share and pull down resources in addition to our resource hub. This past year, we focused a lot on building out a turnkey exercise for folks, essentially. So one of the most effective ways to prepare for a chemical incident is to practice before it happens. But as you know, planners, we wear many, many hats, and a lot of times taking the time to build the exercise is half the battle. So we at NACHO decided, how about we take that lift and build out this exercise so that all you have to do is plug in your information, adjust it as you need to fit your organizational needs, and set a date and have the exercise. So this exercise allows staff and partners to test this decision making, coordination, and communication under realistic conditions. This plan comes with objectives, scenarios, injects, evaluation questions, and again, we've adapted it, not again, but for the first time, but we've adapted it for rural and urban health departments. So when we were going through this, we initially thought we would have one exercise, but as we talked with our health department partners, we realized that it needed to be more nuanced to account for the differences between a rural and urban setting. So what's inside this tabletop exercise package? You'll have 2 situation manuals, one geared towards rural health departments, and this version is focused on smaller resource-limited local health departments, and then an urban-focused version addressing complex, large response. Also included are facilitation slide decks. So the slide decks mirror this situation manual. So all you have, again, update the information, and it'll be ready for you to use in a tabletop exercise. We've also developed facilitation guides with prompts and timelines and best practices. So if you are looking for what to say, follow-up questions, things of that nature, you will find that in the facilitation guides. Also included are exercise evaluation guides. So we took the CDC public health emergency preparedness capabilities and developed exercise evaluation guides to help you evaluate your exercises and kind of have a roadmap for what you should be testing, what you should be looking for in these exercises. Again, these documents are designed in such a way where they are editable, and you can, again, add, take away whatever you need to fit your needs. We figured let's put it out there so that you are not starting with a blank page. You have something to work off of and build off of. And lastly, we developed a template AARIP, After Action Report and Improvement Plan, for you to capture lessons learned. So in this, you will find templated material for an executive summary, your strengths and your areas for improvement, and templated conclusion paragraphs, and for your improvement plan. So again, our goal was to create something that was turnkey and high quality for you to use. And then I'll kind of get into later on that, this was not created in a vacuum, that we worked with our preparedness partners at local health departments to help us refine and build out the scenario and questions asked. Uh, In addition to the tabletop exercise, we've decided to create communication templates as well. One of the things that our focus groups and our conversations with our partners is that communication always tends to be a bit of a sore spot. And while we understand that not all health departments may be responsible for communication during a chemical emergency or have the responsibility for it, but we do encourage throughout the handbook and through our exercises, health department's involvement in crafting those messages and being a part of those joint information centers. So what we've done is built out template press releases that health departments could either use to contribute to the discussion with communications, or use to amplify messaging that's been put out by emergency management, hazmat, whoever is the lead agency in your jurisdictions for a chemical emergency. And so again, the idea, and you can kind of see a little bit with the picture here, is that we've designed the meat and potatoes, if you will, of the press release, but we've got the grayed areas are where we hope that you would change that information and update it to fit your needs. And again, 100% editable document. So use it as a starting point, use it as it is. But we figured, this would be something easy to have the plug and play, because during an emergency, it's not easy to sit down and craft a message. It's kind of nice to be able to pull something out of a binder and start with a leg up. And then we have those companion social media bites. So in this day and age, lots of people consume their news via social media. Very few people, I think, if you're especially Gen Zers, are consuming their news via your traditional television methods. So we decided to build out some graphics and captions to go along with them that will be suitable for Instagram, Twitter slash X, Facebook, or what have you, or whatever the kids are using these days to consume their news. So these documents as well, they will be available via Canva, and we also have them in a Word document where you can also copy and paste, where you can add your logo, put in your health department's information, and then we'll have captions that you can also edit, design as you need, and post and upload. And again, these are just a few examples. We have quite a few in the package that's available on our website. But as you see, they are companions. So we've got an all clear, evacuate, shelter in place, and they've all kind of got little different things to say on them. So again, as I mentioned before, that we didn't create this tabletop exercise in a vacuum. We piloted it at two different sites, and then one at Preparedness Summit. So we did exercises 3 times, and with each exercise, we refined the tabletop scenario plan, questions, the EEGs a little bit each time. So I'll kind of go into the 3 different exercises that we did and kind of what went well, what areas of strength that we noticed in the discussion during these exercises. So the first one was held with the Southern Nevada Health District. Thank you to our partners there. This area is the Las Vegas area, if you're unfamiliar. We had about 40 participants from the health department, fire, EMS, hazmat was there, and tribal representation was there as well. Some discussion highlights were urban response challenges included large homeless population, worried well, and complex hospital coordination. Public-private partnerships with casinos, transit, resource partners, critical for communication and sheltering came to light. And then messaging and equity. There was lots of discussions about having messaging in multiple languages, 911, engaging community ambassadors and outreach to vulnerable populations. And strengths that we noticed and collected during our hot wash was strong cross-sector engagement with health, fire, EMS, the casinos, and transit, a clear use of ICS and joint information system structures to promote one chain of command and orderly response structure and communications. And then there was a lot of brainstorming on vulnerable populations and the best way to conduct outreach. Opportunities for improvement included limited chemical expertise at local health departments and reliance on partners. So really understanding what is the health department's role in a chemical preparedness. Resource strains, PPE, hospital surgeon, EMS decon came to light. And then a need for sustained planning for long-term health monitoring. So a lot of conversation about, hazmat being there the day of, but what about day 2, day 3, day 4, a month later? The Preparedness Summit was an interesting venue to host this exercise because it wasn't one local health department. We had about 46 representatives from different local health departments across the country participate in this exercise. We had a CDC partner and DHS partner there as well, observing throughout the exercise. And so what came to light during this was the clarity of role. By and large, local health departments wanted to know what their role was as a support agency versus lead agency. Many of them recognizing that health departments and public health may not be the lead agency in their jurisdictions, but want to get a clear idea like, well, what can we do to support the response? What should we be doing to support the response? We also what was also beneficial out of this different format was the cross-state comparison, which really enriched learning. So folks were able to hear things that they didn't consider in their jurisdiction. Everything from communication to tools to online resources. It was a really collaborative session, and people were able to share those ideas. What also came out of this was syndromic surveillance and epi registry. So we had quite a few epidemiologists that participated in this exercises, and they had a lot of questions on that, tracking, being able to follow folks long term after, after the incident, and whether or not they would open epi modules within their systems or what that looks like. So there was lots of interesting conversations where some states some representative did say like, yes, our state would definitely be tracking this, and others were thinking like, should we be tracking this? So it was a kind of a good opportunity for folks to bounce ideas. And then something else that came out was the discussion of trust and transparency and trust for public messaging, especially when it comes to vulnerable populations, and how do we craft those messages and have those messages available. And so a lot of that feedback we used to help craft our press releases that we did. So again, strengths were that national level peer exchange across diverse jurisdictions, valuable input on surveillance integration, and then folks considered the scenario actually realistic and engaging, with 83% saying that they strongly agreed that our scenario was realistic and engaging. Opportunities for improvement that we notice, folks asked us to consider the time of year and season in future exercises. Again, clarify local health departments versus lead agency responsibilities in the initial response. And then focusing or trying to build in enhanced hospital or public health communication on chemical exposure. So again, building that communication place between possibly epi folks at the hospital and infectious disease or ID folks public epi folks at public health departments, and the infectious disease or ID folks and emergency management folks in the hospital. They kind of do that communication back and forth. And then lastly, we went to the Eastern Shore in Maryland and worked with Queens Anne, Cecil, and Dorchester County were our lead agencies that helped us put this on, and they invited their surrounding rural health departments there as well. We had about 35 folks show up in all, and it was a mixed bag of health department folks, emergency management, EMS, there as well. So it was also very successful. Challenges included limited hazmat teams, volunteer fire reliance, and delays in mutual aid. There was strong informal networks, folks saying that phone calls were much faster than using web EOC. So they would rather pick up the phone and call up their neighboring counties and partners. Translation and communication came to light, especially when it returns to vulnerable populations, and that was seen as a critical gap. So again, strong cross-county relationships and mutual support. And I would put the caveat more informal than formal in terms of MOUs or whatnot. Practical discussions on evacuation shelter planning for schools, nursing homes, and homebound residents. And then creative local resourcefulness. Some folks making the comments, make friends with your farmers, using churches and nonprofits being the way to go. Opportunities for improvement included, again, translation and outreach to the immigrant and vulnerable pop groups, limited local epi and data capacity. So this one came to light where a lot of these jurisdictions rely on state epidemiologists and don't have local epi to assist with any surveillance needs. And the need for hazmat integration into larger scale scenario planning. So this kind of ties back at the top with limited hazmat teams. Some of the hazmat teams were quoted being regional or one for a large area that may not be practical or timely in an event. So these were some of the things that came to light, and some of the discussions that were had based off the questions that were developed and asked. So we were very pleased with the outcome and the conversations that they were having. And at the end of the day, I think each group took back material that they could use to, again, either update their existing plans um, um, or develop new plans. All right, and then lastly of our resources here, we have the Nature Chemical Preparedness website. So you can find all these things that I've discussed at www.nacho.org/chemprep. Everything is there. Everything there is formatted in a Word doc format. So again, it is 100% editable for you to use and update as you need. To. And we also love to hear your feedback. So if you have any suggestions, there would be a link at the end of this presentation to provide any feedback that you guys have. And we are always looking to improve. I want to do a special thank you to these groups that help informed all of our chemical preparedness activities and resources. They either help review, update, pilot test. A lot of them were instrumental in writing the chemical preparedness handbook, which again was the foundation of the rest of the tools provided. And then thank you to anyone who ever responded to any of our surveys. I know we kind of sent out quite a few, and we had a lot of folks participate in our focus group. So if you're on this call, again, thank you all for the support that you provided in helping us create these tools. All right. So I'm going to quickly go over some of our radiation information that we have as well. So NACCHO does have a radiation preparedness portfolio. Oh, before I go there. And so in partnership with the Radiation Studies Program, a core focus of NACCHO's work in radiation is supporting community reception centers, or CRCs. These are community-based sites that can be set up after a radiological or nuclear incident. Their purpose is to screen and monitor people, provide decontamination if needed, and give clear information to the public. CRCs are essential because they help reduce the burden on hospitals and healthcare facilities by managing the public health response in the community. Local health departments play a central role in planning and managing these centers, often in collaboration with emergency management, healthcare, and volunteer organizations. So let's look at some of the things that NACCHO has provided. So if you go to our NACCHO website and go to our resource hub, our IT team worked very hard to put this resource hub together. Search radiation, search CRCs, and you will see a plethora of resources that we've collected from other health department, resources that were put together by NACCHO, and resources from CDC that are available for you to download and use today. And so you'll see a CRC toolkit with planning guidance and templates, training modules and exercise supports for local staff, past webinars just like this one, and peer-to-peer learning that's available on there, and case studies highlighting CRC planning in action. So again, a suite of tools available for you, dating dating back to what I've seen was 2015 all the way to current or 2024 was the last document that I saw was uploaded to this system. Alongside CDC, NACCHO also has worked closely with local level stakeholders to help plan both discussion-based and operational radiation preparedness exercises. These exercises were used to pilot radiation preparedness resources developed by CDC and to collect data to inform the development of CDC models and systems. Beyond those strategic aims, project exercises activity also acted as capacity building and technical assistance opportunities to local health departments and radiation preparedness and exercise planning. So in the past, for these particular exercises that you see on your screen, NACCHO has assisted with building scenarios, objectives, and injects, and developing actor cards. We've developed exercise planning documents such as situation manuals, facilitation guides, and exercise evaluation guides. So we've worked very closely with all of these partners, and we've been either they've invited us just to be observers, evaluators, observers, all the way to helping them develop the complete exercise. And we've done this in multiple formats, in using the game This Is a Test as the backbone for a lot of that too. We also host at this point an annual radiation workshop, which again focuses on strengthening CRC preparedness. So not last year, but the year before, we did host a workshop where we encourage gameplay, essentially. So we had successful national workshop convened with local health departments, preparedness coordinators and their partners, shared resources and lessons learned in radiation, had a hands-on opportunity to exercise together, and again, across jurisdictions and build partnerships. Again, this featured CDC's This Is a Test, the CRC edition, training simulation tool, and it enhanced local capacity to plan and operate community reception centers. So many participants said they walked away with tools and templates they could take home and adapt to their local plans. Others told us that the workshop helped them think more concretely about real world issues like staffing, space management, and coordination. And most importantly, participants reported feeling more confident about their ability to plan for these high impact, low probability events. So the photos that you see here are real photos from our preparedness summit of folks playing the game. And so again, all these resources, the game itself, we have links to them on our website, on our radiation page, and on our NACCHO resource hub. Lastly, NACCHO also has a radiation work group. So the objective is to raise local health department awareness of radiological preparedness tools. Members include local, state, and federal partners and preparedness professionals with radiation subject matter expertise. The roles and activities include reviewing and advising on NACCHO radiation resources, our policy statements, incorporate practitioner insights into new materials and strategies either developed by NACCHO or the CDC, helps us plan our radiation workshop at the Preparedness Summit as well. Engagements are regularly monthly conference calls, maybe sometimes attendance at national meetings. We may pay for, NACCHO may pay for a representative to go, and then input on preparedness materials. And then you have an opportunity to join this work group. We'll probably be kicking up again sometime in October or in the new year as we begin the new project work. So stay tuned, watch out for our newsletters. In the meantime, you can search NACCHO advisory groups, and that's where it is posted when those advisory groups are open for recruitment and new members. If you have questions, feel free to email me directly and I can point you in the right direction if you're interested in joining one of our work groups. Okay, so that was quite a bit there. So I will stop there and pass it on to James and Allison.
Hi, thanks, Jerry. Hi, I'm Allison Stargell. I'm an environmental health scientist with ATSDR, and I've had the privilege of working with NACCHO as a technical monitor on the Chemical Preparedness Project for the past 2 years. I would like to first of all thank NACCHO for all of their hard work, and I hope that you all find this information and resources that they've shared helpful and useful. We hope that you will continue to explore these resources and consider joining the community of practice for more information and discussion on preparing for low probability, high impact chemical emergencies. Please know that we're always here to support you with any questions or requests that you may have. And with that, I'm going to turn it over to Commander James Gooch for the next portion. Thank you.
Thanks, Allison. Hello, everyone. My name is Commander James Gooch, and I'm with the Disaster Risk Reduction Team in CDC's National Center for Environmental Health, where we focus on community risk mitigation and disaster readiness. It's a pleasure to be with you today. As has been mentioned, the intention really today's webinar is to help not only expand our awareness of the resources for chemical and radiation emergencies, but also to start building a bridge for these hazards with your jurisdictional planning. Both hazards represent low frequency and high consequence emergencies, as Allison just mentioned. Both require also intentional and specialized planning, involving a slew of subject matter experts, timely public health messaging, and very close coordination with emergency management, healthcare, public health, environmental health specialists, as well as many, many other first responders. We really hope you'll find with today's webinar that we're advancing this all hazards approach for both these hazards with a collaboration between NACCHO, ASTO, and many other organizations to really strengthen our nation's ability to respond to both chemical and radiological emergencies with agility and resiliency. We're now going to pivot in the webinar to the topic of radiation emergencies, and it's my distinct honor and privilege to introduce our next speaker, Annie Evans from the Association of State and Territorial Health Officials, or ASTO. Annie leads ASTO's preparedness portfolio as the Director of Preparedness, and Annie also plays a key role in the National Alliance for Radiation Readiness, or NAR. And as you'll hear, NAR brings together public health, radiation control, emergency management, healthcare, and even animal and agricultural partners to the table, and really reflects that radiation preparedness, like chemical preparedness, which is inherently multidisciplinary and fairly complex. And so with that, I'm very pleased to turn over to Annie, who will share some of ASTO's resources and the critical role of NAR in enhancing our collective radiation preparedness. Annie?
Well, thank you, Captain Gooch, and the honor is mine to join you all today. So good afternoon, everyone, and thanks for giving me a chance to share some information with you about the National Alliance for Radiation Readiness today, or the NAR as we call it. As Captain Gooch mentioned, I am Annie Evans. I'm the Director on the Preparedness team at the Association of State and Territorial Health Officials, or ASTO. I'm just going to walk you through a couple of a little bit of information about the NAR, and we're going to share some resources as well. So next slide, please. All right, so we're going to start with a level set of what is the NAR. But before I get into it, I just want to do a little bit of a pulse check with you all and see if you're familiar with the NAR already. So if you wouldn't mind taking a moment in the chat to just throw me a thumbs up if you have no idea what the NAR is, if you've never heard of it before. Right. Okay, so we got some folks that are new. Okay. Now we'll take a pause, and can you throw me a thumbs up or some other sign that if you're familiar with the NAR? Okay, got some thumbs. Be a few more. We've got some familiarity. Some people still unsure. Great. Okay, see a thumbs down. All right, well, that's okay. All right, now we'll pause there. And I want to hear if we have any NAR experts in the room. So throw me a thumbs up if you're really familiar with the NAR, if you've worked with us before, you use some of our resources, something like that. All right, lots of no's. That's okay. I got a thumbs up from Angela Lee. Great, glad to see you, and glad to hear that. Fantastic. So not a lot of people who are super familiar with this this group that we run, which is totally fine. You're going to be an expert after the end of today. We'll go to the next slide, please. I'm going to start off with just kind of an overview of the structure of the NAR and what it does. So the NAR is made up of two different types of organizations. We have member organizations and federal partners, which I'll talk about in just a moment. But I want to take a minute to just introduce you to the concept of our member organizations. So we do have a list of member orgs on the screen here, and I am going to read through them just because I want to give you a sense of the kind of the breadth of expertise that is involved in this group. I want to point out here as well that in particular, that ASTO and NACCHO are members of the NAR. So we have 20 organizations that are listed listed here. We actually just added our 20th this past summer, so we're looking forward to kind of including many more folks over the next period of the NAR. So our member organizations are the American Academy of Pediatrics, or AAP, the American Association of Poison Control Centers, or AAPCC, the American Hospital Association, or AHA, the American Medical Association, or AMA, the American Public Health Association, or APHA, the Association of Public Health Laboratories, or APHL, the Association of Schools of Public Health, or ASPPH, ASTO, which I mentioned, the Association of State and Territorial Health Officials, the Conference of Radiation Control Program Directors, or CRCPD, the Council of State and Territorial Epidemiologists, or CSTE, the Health Physics Society, or HPS, the International Association of Emergency Managers, or IAEM, the National Alliance of State, Animal, and Agricultural Emergency Programs, or NACIP. That's our 20th member. We're excited to have them included now. The National Association of County and City Health Officials, or NACHO. So, again, you guys are represented here as well. The National Association of State EMS Officials, or NASEMSO, the National Disaster Life Support Foundation, or NDLSF, the National Emergency Management Association, or NEMA, and the National Public Health Information Coalition, or NIFIC, the Radiation Injury Treatment Network, or RITN, and the Society for Disaster Medicine and Public Health, or SDMPH. So again, lots of expertise here, lots of professionals within this group of member organizations. Next slide, please. I'm going to talk about our next set of partners here, which is our federal partners. So we do have 10 federal partners that are included within the NAR, and you're probably familiar with a lot of the names on this list, and I'll go through them as well, just so again you can understand the connections that are here within this organization. So we have the EPA, we have the Department of Energy, we have USDA, CDC, ASPR, DHS, the NRC, the FBI, FEMA, and FDA. So lots of different expertise that'll all come together within this group. Next slide, please. I'm going to tell you a little bit about how the NAR is run here. So we are overseen by an executive committee, which is a group of selected and elected positions that come together to represent all of the different voices that we have in the NAR. So I just want to point out that ASTO and CDC as the funding agency for this group do have non-voting seats on this executive committee as well. But beyond that, we have members that represent a wide variety of different voices that are included in the NAR. We have folks that represent our radiation groups. We have our emergency managers, our healthcare, our public health, and NACHO also does have a seat on our executive committee at this point in time. So Robert Goff, who I'll talk a little bit more about later, is the NACHO representative and serves as what we call our member at large tri-chair. So lots of expertise, and this group of experts really also comes together to give us a strategic direction throughout our activities and throughout our project year. Next slide, please. So I want to talk a little bit about the structure of the governance of the NAR. You might be wondering how all these groups kind of work together. So as I've mentioned, we do have this executive committee that helps steer us along, as well as we get input from our funding agency, which is CDC, and our sponsoring organization, which is currently ASTO. And the sponsoring organization really just provides some administrative support to this group so we can kind of organize everybody and bring them together. Now, under those groups are the two types of partners that we mentioned, our member organizations and our federal agencies. And those are each represented by different designees. So for member organizations, we have a staff representative and a member representative. So we have both kind of the staff voice as well as the member voice. And our federal agencies have designated federal liaisons that kind of funnel information to us as well. Next slide, please. So now you know a little bit about how the NAR is structured. You might be asking yourself, what does the NAR do? Next slide, please. So the NAR the purpose of the NAR is to kind of act as this voice of health in radiation readiness. So I mentioned we bring together a lot of different fields, a lot of different expertise that is represented across our organization. And our vision here is to become a more protected, resilient nation through a comprehensive and integrated approach to radiological emergencies. Our mission is to enhance radiological preparedness and capability and capacity in public health and healthcare systems through this coalition of organizations committed to improving the nation's ability to prepare, respond, and recover from radiological emergencies at all levels of government. So we're really trying to bring together, again, a wide variety of people, wide variety of expertise, and really bring in those connections across different levels of government. So you'll have noticed that we have federal partners, we have state partners, and we have local partners. So everyone has a voice in this group. Next slide, please. So something else that the NAR can do is activate during an emergency. Now, this is not necessarily a traditional activation like you would maybe have in an EOP or something like that, but we are in this in an activated capacity can serve as a conduit for information and communication during a radiological incident. So we share situational awareness with our members and federal partners. We serve as a place to convene, have conversations about different things that might be happening, and we serve as a point of coordination again between the variety of experts that we include, as well as the different types of or the different levels of government that are involved in the NAR. We are also able to give expertise. You saw the broad list of groups that we have involved in this area, so we can very easily get information out to tens of thousands of professionals who may be involved in the response to a radiological incident, or we are able to identify maybe specialized experts who might have some input, some valuable input during an incident as well. And we have been kind of testing and revising this process of activation over the course of the last couple of years. I can share a little bit more about that, but that's kind of what our involvement looks like at that point. Next slide, please. So the next question that might be on your mind is how you might be able to benefit from the NAR as well. So there are a couple ways that you can engage with us throughout the year. One is networking. We're able to connect you with subject matter experts that may be able to provide input on some specialized piece of your plan that you might be working on, things like that. So we're certainly happy to help with networking. We're also able to share information and resources with you. You can get access to guidance documents, reference information templates on our website, which I'll talk a little bit more about shortly. You're able to ask questions and get expert input from us as well. So if you're getting in touch with us, we can share, we can help you find the right people and the right questions that you might need for your planning process. We also host trainings and webinars throughout the year, and we share events from other relevant partners as well. So this is really a localized or like a centralized place where you can find information about this space in a lot of different ways. We're also available for cross collaboration. Again, you saw the wide variety of experts that we have, so we're really able to help you find new perspectives from different fields, and especially in this particular area of preparedness and response, because you require input from a lot of different folks. So we're able to help you facilitate that as well. So you can get in touch with us on that too. Next slide, please. So now you might be wondering how you can get involved with the NAR as well. And I just want to point out a couple of different strategies here. Is that one, you can get in touch with NACCHO's member representative or staff representative. So you all know Jerry, who's just speaking to us, so he can help you get in touch with us, as well as Robert Goff, who I mentioned, is the NACCHO representative on our executive committee at this point in time. So feel free to get in touch with them and ask some questions about NACCHO's involvement with the NAR. But you're also able to follow ASTO's newsletters and social media to get announcements about upcoming NAR events. That's where things will go out. So definitely get in touch with or get connected to ASTO's media outlets as well if you haven't already. And then finally, you want to use the NAR website, which we'll be dropping in the chat as well. That's radiationready.org, and we post, again, a lot of different information, which I'll talk about shortly, but you can follow along there as well. Next slide, please. All right, so we're going to talk a little bit about some activities that we've been up to over the course of the last couple of years, so you can kind of get a sense for what we can do as well. Next slide, please. So the first thing that I want to point to is this NAR 5-year strategic planning goal, which has been a collaborative effort across all of our member representatives to put this together over the course of the last couple of years. So this has been active from a period of 2024 through 2029. So we've been chipping away at it over the course of this year. So there's 5 different objectives here. The first 2 revolve around kind of an assessment of what are gaps in radiation readiness, knowledge, and capacity across the fields of involvement within the NAR. So that's public health, healthcare, and emergency management. And one of our objectives here was kind of to identify a baseline level of knowledge across these fields. So some of you may have been involved with the radiation readiness capacity assessment that we launched last year or earlier this year actually, and have just finalized. And I'll talk a little bit more about that. But these objectives kind of helped us design that assessment there. And our remaining objectives will be to then take the results of these assessments and then kind of work to fill some of the gaps that we've identified through that process. So we're kind of entering that stage now. Next slide, please. We've also been participating in a number of national exercises as the NAR. So here's a couple that we participated in over the course of the last couple of years. The first is Cobalt Magnet 25, which happened just in March. We participated alongside CDC with the purpose of really kind of testing our SOP and understanding what our engagement would look like in a real incident if we were to be activated. So we wanted to see how our SOP would work, test the usefulness and the ability for the NAR to identify some of these experts that we've been discussing. And the focus was working on our communications processes and collaboration abilities. And we've made some adjustments to our SOP as a result of this. We collected a lot of different questions that our members would have had, and I think this will help us prepare for how we can better serve both our members and the broader public health community in a real incident. So that's one piece that we've been doing, or that we did over this last year. We also participated in INEX 6, which was led by EPA. We were invited to participate in this process with them. We led the health module, and then our members were able to participate as players in this process as well. So we were able to share a lot of perspectives and bring new expertise to that conversation, which has now been wrapped up, and some of those recommendations have been shared across the government as well. So those are two exercises that we've been a part of over the course of the last couple of years. Next slide, please. So I've teased you on this a little bit, and I want to get into a few more details now, which is we've also recently completed this radiation readiness needs assessment, which I mentioned was really kind of aimed to establish this baseline level of knowledge of radiation readiness among the professionals who work in the fields related to the NAR. So again, public health, healthcare, and emergency management. And so we could identify gaps in these areas, and then in subsequent years of our work to fill some of those gaps. So we had over 425 responses to this survey, which was great engagement for us. On the slide, you'll just see a bit of a breakdown of what those of the participation from each of these three fields here as well. But I wanted to point out to this group as well that we did have a lot of local respondents to this, so lots of valuable data from the local perspective as well. And this was conducted as part of this 5-year strategic planning goal. Next slide, please. So we'll talk about this in a little bit, but I will share where you can find some information about resources or about that assessment. But before I do that, I want to talk a little bit more about our resources et al. And again, you can find some resources for ours at radiationready.org. So feel free to follow along there while we go through this last bit of the presentation. Next slide, please. So this is our website. We have a lot of great information here. We have a resource library as well that I've mentioned. We've got a lot of really great resources, more of which I'll talk about in just a moment. But this is a specific collection of items that are related to radiation readiness. So lots of guidelines, templates, communication items, things like that. You can find all of these things on our website here. We also have information about the NAR if you're interested in learning a little bit more, and information about our members and federal partners, ways to get in touch, and of course, some events that we have coming up from NAR, as well as all of our member organizations as well. Next slide, please. So here you've got a list of selected resources, and I just want to point out a couple of them. But again, there's a lot more on our website. But as I speak about each of these, do feel free to scan the QR codes for each of them and check them out as well. So I mentioned we've got lots of resources on our website. Again, they're all relevant to radiation readiness, and they're all available to you for free, like for access. So feel free to check them out. So just to highlight a few, I wanted to point out this is a test board game from CDC. You've heard a little bit about this from Jerry already, but also Lauren Finkley, who's on the call today, can share a little bit more about this particular resource. We also have a link to a blog that ASTO and NACEP wrote together when NACEP joined the NAR for the first time, just to share a little bit of information on inclusion of animal perspectives in preparedness and radiation readiness as well. So if you're interested in learning a little bit more about what they do, please feel free to check that out. We have links to other types of resources like training for public health workers on radiation readiness. I thought this in particular might be of interest to you all. So these are free public health training modules for radiation readiness that the NAR developed several years ago, and they may be useful to help bring any new staff that you have in your agency up to speed on this particular topic. We also have some documents on nuclear detonation, specifically around communication and other activities that you might do in that first 72-hour period following a nuclear detonation. So all these types of guidance documents you can find on the NAR. And again, feel free to scan those QR codes and check those out. We also have perspectives on past disasters. So I just pointed out one here that CDC had published a paper on public health perspectives on Fukushima. So those are some types of resources that we have as well. And then you'll also see recordings of webinars. So one of the past webinars that we did was kind of leveraging mental models for first responders on a radiological incident. So we actually have the speaker, I think, of the webinar as an attendee here today. So shout out to Angela Lee for that. So if you're interested in hearing more about her work, you can scan that QR code there and check that out. So lots of great information, but this is just a sampling of some of the things that we have on the website. Next slide, please. Last one, and I've been teasing you on this already, so I just wanted to make sure to cover it too, is kind of some summary materials describing some of the key findings that we had on this radiation readiness assessment that we conducted over the course of the last year. So if you scan the QR code there, you'll see that that brief report that we just put out this last month in July on the results of that assessment. And we are still working on getting a set of summary slides up on our website, but if you're interested in those, feel free to shoot me an email after this too, and I can also get them in your inbox sooner, but they will shortly be available on our website. So just some summary slides that go through, again, some of these key findings, some of the charts and breakdowns of the findings that we had, as well as some key quotes. We got a lot of really great testimonials and perspectives in our qualitative data for that assessment, and you can see a little bit more of what that looks like in our slide set as well. So feel free to check that out. And again, if you have questions, feel free to shoot me an email after this. Next slide, please. All right, great. And then the final thing that I wanted to point out about our resources is that we really want to hear from folks on what you're using, what's useful. We really offer up an opportunity to share information across different jurisdictions about this. We know how valuable that is for you all that may have limited capacity to work in this area. So if there's something that you're using or something that you feel like is a best practice that you want to share an example of within your jurisdiction, please feel free to drop us a line about that in our Submit a Resource button. We, again, really want to hear from you and share best practices when we can. So feel free to do that. Next slide, please. All right, so before I wrap things up, I just again want to note that I'd really love to hear from you all. So definitely, as we go into the discussion period, feel free to share a little bit about how the NAR can support your jurisdiction. We really take feedback from our members very seriously, and we want to know what you feel like the gaps are, how we can support you. So feel free to share thoughts on that with us in the chat, or again, get in touch with me after the webinar today. Well, next slide, please. So just the last piece, here's our contact information, and I'll drop this in the chat after we wrap things up shortly. You can shoot me an email at aevans@asto.org or nar@asto.org. And again, we'd love to hear from you. So please tell us how we can be of use to you all. All right, that's it for me. I think we're going to pass it to Lauren Finkley next.
Thanks, Annie. My name is Dr. Lauren Finkley, and I'm the lead health physicist of the Radiation Studies section within the National Center for Environmental Health. And as you heard from Annie, I am the creator of the training and exercise serious game, This is the Test. We just learned about the many resources that have been developed in collaboration with NACCHO, ASTO, and the NAR, CDC, and you. These tools have been built with jurisdictions for jurisdictions so that you can customize them for your response needs. As you've heard, chemical and radiation emergencies are thankfully low likelihood events. While we don't often see these types of emergencies, we can be better prepared by incorporating chemical and radiation resources into our all hazards plans, resulting in lives saved. Each agency on this call provides technical assistance and resources to improve your preparedness toolkit. We hope to hear more about additional resources you might need, how better to improve your capacity, and reduce the development burden in planning complex exercises. Thank you again for joining us today, and I'll turn it over to Jerry for our question and answer portion.
Thank you, Lauren. All right, so now we want to hear from you all. Let's start. You can either drop questions in the chat or raise your hand and we will call on you.
Jerry, I'll start us off with one that came in by the Q&A. So is NACCHO's virtual community open only to NACCHO members or all public health staff?
Generally to NACCHO members. So if your health department is a NACCHO member, and you work for that health department, then yes, you can get access to NACCHO virtual communities.
Okay, we also had a question, are any resources like those that are being shared for access and functional needs communities?
Give some input on that, Jerry, if that's
Yeah.
helpful. So that's we do have some resources available on the NAR on this particular topic, and I know there's some jurisdictions that have done some really great work in this space, both in like on the radiation side as well as the chem prep side. So feel free, if you want to shoot me an email, we can talk a little bit more about specific like resources that might be available. I personally do not know of like a network, maybe like the NAR, that would be available for that. But again, I'm happy to share some information about best practices or some information about other work that ASTO has done in the disability inclusion and kind of stakeholder engagement and preparedness realm as well.
So on that same line, what is the NAR's relationship with NSPS/NETEC?
Right. So neither of those groups are a member at this point in time. We haven't had a collaboration with them yet, but we're always looking for new members, and I will take that suggestion and maybe we'll see if we can get a conversation going. And if you have a connection or you're a member of one of those groups, again, feel free to shoot me an email and we can have a conversation about that. We're always looking to expand the network and bring in other relevant professionals.
Okay, another question, how would state National Guards become involved in operating a CRC?
Yeah, I'll take a stab at that. So I think the first step, since state National Guards, I would say reach out to your state health departments. Most state health departments have a director of public health preparedness, and I think that would be the first method to go through. And then they can connect you to any kind of any local health departments that may be hosting an exercise or looking to incorporate that type of support in your plans. But yeah, I would definitely start with state directors of public health. State directors of public health emergency preparedness, I'm sorry. Yeah, so the DPHPs to build those connections right from the start.
Okay, another question. The assessment of dose forms provided by CDC are cumbersome. Are there any simplified algorithms/forms that we could use as CRC staff by volunteers or other public health staff?
Yes, I can take that one. So yes, we have gotten that feedback before, and currently we have been in the process of updating the forms with our EPIs as well as some feedback from the radiation work group. So that's something hopefully that could be updated in the next year or so. And then when it's available, it could be shared through the NAR as well as NACHO.
Okay, can you speak to how medical evaluations for potentially exposed individuals are being managed in community reception centers? Specifically, are any jurisdictions integrating laboratory testing into their community reception centers, or is that typically handled separately?
I can take that one too. So I believe right now what we've seen is that sometimes it's in the plans, but it's not often exercised because that's more of a step 2, right? You want to make sure you have the basics and then you add that on. I would welcome any jurisdictions who have done that to, share more about that in the chat or link. I think that also we would be happy to put you in contact with the radiation lab if you had questions on that process.
Do any of the resources include ERSI mapping capability to determine blast radius and types of exposure for exercises or real life?
Can you repeat the question?
Yes.
I see it. Okay. Do you have any? Yes, there are resources. CDC has some, but also ASPR has some, and I believe that the NAR likely links to that as well as the NACHO toolkit. But there are some within the ASTO toolkit or the REM website. But if there are specific resources you're looking for, I know we'd be happy to help put you with those.
And I just dropped a link in there in the chat as well from Annie about the access and functional needs question.
Oh, and then I see the ESRI mapping. The mapping resource, that might be something that you would want to work with your state GIS, as well as there are tools such as Rad Responder that you could likely link with. But that might be something that you'd want to work on overlays with your mapping specialists in your state.
Do you address medical countermeasures for radiation and chemical preparedness?
So regarding chemical and radiation, it's something that we started to explore at NACCHO. So we do have a medical countermeasures work group and a surge management work group. And very recently, towards the end of this project year, we've started dipping our toes in the water about merging these groups, or at least getting them to work together on some sort of project. So we are fleshing out those details, but don't have any concrete resources regarding that just yet.
Yeah, and I can jump in from the NAR side as well. We do have a couple of resources around medical countermeasures on the NAR website, and that's certainly like a topic of discussion in this space. If you have specific questions or things that you'd like to get some input on, again, feel free to shoot me an email and we can talk a little bit more specifically about it. But yeah, there are certainly some resources and some work on that. And then just one more note on the AFN question as well. So in terms of decon, I did just want to highlight that the resource that dropped in the chat is from Tennessee, who's done a lot of really great work in this area. That's again a big shout out to Robert Goff, who does a lot of this. So if you have questions about that, again, feel free to shoot me an email. We can get you in touch with some folks who can maybe give you some examples, or we can talk more about specific questions or maybe challenges that you're working through as well. So feel free to shoot us a message.
Jerry, we see your email.
Additionally, I put in the chat the CDC radiation medical countermeasures page. You could always reach out to us. We have a medical countermeasures task force for radiation, as well as we work very closely with ASPR and BARDA, and as well as the NAR. So definitely there are resources. It just depends exactly what you're looking for to kind of say who to point you towards.
So there's a question about if all these links are going to be shared in the materials, and the answer is yes. We'll be posting them on NACCHO's website and then sharing them with registrants from this webinar via email. Not seeing more questions at this point. Can I get a link to the medical countermeasure task force? I'm not sure if one of our panelists can help with that.
Yeah, you can always contact me. You can email lna8@cdc.gov, and then I can put you in contact with the right people.
I'm not sure if we answered this one. Are there any federal partners you work with relevant to medical countermeasures?
Yeah, hey, this is Captain Sugar. I can take a quick stab at this just from our side, and then I don't know if others want to weigh in, but I did want to mention that through Health and Human Services, ASPR, which is I think what Lauren was just mentioning, we do have a public health emergency medical countermeasure enterprise, or FEMC. Many of you are probably familiar with that. But this does give us an opportunity at the federal level to come together from many different organizations, including Department of Homeland Security, many agencies within HHS, where we serve on work groups and can give recommendations. And so, as mentioned, we do have quite a network. And so please feel free to reach out, and we're happy to connect you on the federal side. And not sure, Jerry, if you have anything further to add. Thanks.
Yeah, the only thing I would include is that, yes, we do work with ASPR and have a cooperative agreement with them as well, and do partner with them on both the medical countermeasures piece and surge management piece as well. They do have representation on our work groups. So.
And also add from the NAR side, yeah, we do also connect with ASPR BARDA specifically, who does a lot of work with medical countermeasures. And I know there's some other questions here about working with REACTS and FEMA Rep, and we do have some connections through the NAR on that as well. So if you have specific questions about like what that work looks like, again, feel free to shoot us an email.
Yeah, and about reacts, I think depending on what it is and what the scenario is, that's kind of who you triage things to for the federal agencies. So they're also a great partner through the Department of Energy as a resource. So lots of different partners, and I know all of our different websites kind of link to each other. And then we can share those resources following this webinar.
There's one question, given the changes in SNS, would that agency still be counted on to provide medical countermeasures in an emergency?
I could jump in really quick on that. There's always changes, right, to any program. And so I definitely don't want to speak for ASPR SNS, but we're happy to drop you a link in the chat for that particular program. And there should be some information on their website about information that is shareable to the public. But yes, that program is still active and it's still being run by Health and Human Services.
Looks like we're getting thank yous for the speakers. I don't see any new questions at the moment.
Okay. Any final comments from our panelists? Awesome. All right. So if you guys think of any questions along the way, I do have let me navigate back to the slide here. We do have opportunities to engage with us. So you'll see opportunities here at a Preparedness Summit coming up. So subscribe to our newsletter. Here are our emails for Annie and I. You can join a preparedness work group or join ChemPrep Connect for more information. And then lastly, I do have a QR code for feedback. We always love to hear ways to improve the webinar, our resources, or any general thoughts that you have. There is kind of an open dialogue box there for you to contribute your thoughts there. So please feel free to contribute, send us your feedback. With that said, I want to thank our panelists. I want to thank you all for joining us and making this a successful event. We hope that you were able to take away nuggets of information back to your health departments and take advantage of all the resources that are available to you. With that said, hearing no more questions, thank you all so much for your time and enjoy the rest of your week. Thanks.